Hi, hello, welcome to all. Today's topic is behavioral therapy. Definition: behavior therapy is a form of psychotherapy involves identifying maladaptive behaviors and seeking to correct these by applying the principles of learning. Behavior therapy is a short duration therapy, easy to train, and it is cost effective. Total duration of therapy is usually 6 to 8 weeks. Initial sessions are given daily, but the later sessions are spaced out. The principles of behavior therapies include theory of classical conditioning, theory of operant conditioning, social learning theory. Indications of behavior therapy: obsessive compulsive disorder, PTSD, depression, social phobia, bipolar disorder, schizophrenia, autism, personality disorder, substance abuse, and eating disorder. Behavior therapy technique include systemic desensitization, flooding, therapeutic graded exposure, participant modeling, assertiveness training, social skill training, aversion therapy, shaping, Prima principle, extinction, token economy, contingency contracting, overt sensitization, covert sensitization, and timeout. Systemic desensitization developed by Joseph Wolf. The steps of this systemic desensitization include relaxation training, hierarchy construction, 10 to 12 condition in order of increasing anxiety, desensitization of stimulus, gradual exposure of individual from least anxiety provoking situation to most anxiety provoking situation in a deeply relaxed state. Suitable for anxiety disorder, phobic disorder, obsessive compulsive disorder, and sexual disorder. Flooding. Flooding means suddenly exposing the patient to anxiety provoking situation. No relaxation training, no grading, exposing the individual directly with the situation based on the principle that escaping from anxiety reinforces anxiety through conditioning. Prematurely withdrawing from this situation may reinforce the phobia. Not suitable for client with heart disease, fragile psychological adaptation. This is an example for flooding. If the patient is fearful for lift or accelerator, we suddenly pushing the patient into the lift or accelerator to reduce the anxiety. Therapeutic graded exposure. Therapeutic graded exposure is similar to the systemic desensitization, except that relaxation training is not involved and treatment is usually carried out in a real life context. Participant modeling. In participant modeling, patients learn a new behavior by imitation, primarily by observation, without having to perform the behavior until they feel ready. Useful in phobic children. Children with the problems are placed with the children of own age and sex who approach the feared situation together. Next one is assertiveness training. Assertiveness training is a form of behavior therapy designed to help people stand up for themselves, to empower themselves in more contemporary terms. Assertive response promote fairness and equality in human interactions based on a positive sense of respect for self and others. These are some of the techniques used for assertiveness training. First one is repeated assertion or broken record. It is the ability of the person to repeatedly refuse the maladaptive behavior. Next one is fogging. Fogging is the ability of the person to stand up for the truth. Native assertion, ability of a person to accept the negative criticism or comment. Native inquiry, ability of the person to inquire about negative criticism and accept the positive one. Free information means sharing and getting information from others. Self-disclosure, ability of the person to open up self-experience. Workable compromise means making compromise with all other people. So, social skill training. A major goal of social skill training is teaching persons about the verbal as well as non-verbal behavior involved in social interaction. Social skills training is a form of behavior therapy used by teachers, therapists, and trainers to help the person who have difficulties relating to other people. Examples of social skills are eye contact, smiling, shaking hands, using the right tone, volume of your voice, expressing opinion to others, showing empathy, appropriate emotional response. Technique used for social skill training are instruction, role play, corrective feedback, positive reinforcement, and homework assignment. Aversion therapy. When a noxious stimulus or punishment is presented immediately after a specific maladaptive behavior response, theoretically the response is eventually inhibited and extinguished. The types of aversion therapy include electrical aversion, chemical aversion, aversion through emesis. In electrical aversion, a small electric shock is delivered with the maladaptive behavior in order to stop the behavior. Chemical aversion example disulfiram is given as a treatment for patient with alcohol dependence. If the patient take alcohol with disulfiram, there will be severe disulfiram ethanol reactions. Other types of aversion therapies are corporal punishment, social disapproval. Aversion therapy is suitable for patients with alcohol dependence, paraphilias, impulsive and obsessive behavior. Next one is shaping. Shaping is a method of training by which successive approximations towards a target behavior are reinforced. A behavior shaping is a variant of operant conditioning. Instead of waiting for a subject to exhibit a desired behavior, any other behavior leading to the target behavior is rewarded. For example, speech therapy in an autistic child. So, the child will learn first word, then sentence, then complete speech. Primark principle. The Primark principle was derived from a study of Sebus monkeys by Professor David Primark. Primark principle suggests the person will perform a less desirable activity to get at the more desirable activity. That is, activities may themselves reinforces. Example, R1 is frequently occurring response, that is telephone talking with the friends. R2 is less frequently occurring response, that is completing the homework. Uh, Person is allowing to do the R1 only after R2. That means completion of homework may get incentive telephone talking. Extinction. Extinction as a procedure occurs when a reinforcement of a previously reinforced maladaptive behavior is discontinued. As a result, the frequency of that behavior decreases in the future. For example, a child with temper tantrum, parents reduce attention to his temper tantrum. Gradually, the behavior is decreased. Token economy, an operant technique applied to groups such as classroom or mental hospital ward, involving the distribution of tokens or other indicators of reinforcement on desired behavior. The token can later exchange for privileges, food, and other reinforcers. Contingency contracting. A contract is drawn up among all parties involved. Desired behavior changes is expressed in writing. Contract is made for the reinforcement of compliance with the adaptive behavior or punishment for non-compliance with the adaptive behavior. Restitution or overcorrection. Restitution means restoring the disturbed situation to a state that is much better than what it was before the occurrence of problem behavior. For example, if a patient passes urine in the ward, he would be required to clean the dirty area but also mop the entire larger area of the floor of the ward. Timeout is another method of behavior therapy. Is an aversive stimulus or punishment during which the client is removed from the environment where the unacceptable behavior is being exhibited. The client is usually isolated so that reinforcement from attention of others is absent. Reciprocal inhibition, also called counter conditioning, it decreases or eliminates a behavior by introducing a more adaptive behavior, but one that is incompatible with the unacceptable behavior. For example, relaxation exercise is given for a patient with a phobic disorder. Overt sensitization is same as aversion therapy. For example, a outside native stimuli is introduced with maladaptive behavior. For example, disulfiram is given for a patient with alcohol dependence. Covert sensitization. Individual imagination is used to produce unpleasant symptoms with maladaptive behavior. For example, individual learn mental imaginary to visualize nauseated scene or induce mild feeling of nausea when he want to drink alcohol. Exposure and response prevention is a treatment method available from behavioral psychologists and cognitive behavior therapists for a variety of anxiety disorder, obsessive compulsive disorder, and phobias. For example, a patient with a disorder of repeated hand washing is exposed to dirt but not allowed to wash his hands. Likewise, he may reduce hand washing. Role of the nurse in behavior therapy. An assessment is conducted to identify behavior that are unacceptable. Nursing diagnoses are formulated and outcome criteria are established. A plan for behavior modification is devised using techniques thought to be most appropriate for the client. All members of the treatment team must be made aware of the behavior modification plan. Consistency amongst all staff is required. Evaluation of care is based on achievement of the outcome criteria. That's all about behavior therapy. Thank you all.